you so much, Minister Allen, and to God be the glory. For those that are watching, I hope it is being very helpful to you. So today, my topic is going to be something that many of you may never have heard of, or you may have heard of it or feel the symptoms and don't know what it is. And that is brain fog. There's a lot of people that do suffer from this, and they don't really realize what exactly they're suffering from. So I'll take the time to go through these slides with you. So brain fog. So have you ever just lost your train of thought while you're in the middle of an activity? Or maybe you're caught up in conversation and suddenly you have trouble remembering that word or detail that just slipped out of reach. These events are common as you get older. But if your thinking has been affected suddenly and gradually worsens, so you have difficulty focusing or putting your thoughts into words, you may be experiencing what's called brain fog. Brain fog has become a popular term of the moment, and why brain fog may happen as a symptom and other common conditions. It does happen because of that. So what exactly is brain fog? Brain fog doesn't have a single official definition or medical diagnosis. Instead, it is often a cluster of cognitive symptoms that people experience. Brain fog can be a lot of things to different people. It can include any or all of the following: trouble focusing, difficulty staying attentive, difficulty holding conversations, trouble remembering familiar details like names, places, or words, slow reaction times and information processing, general fatigue and lethargy, cloudiness in judgment, frequent loss of train of thought, inability to work quickly or multitask. When you have deficits of these areas, you may feel like you're having memory problems, but it's more of a problem of acquiring and maintaining the right information. So what causes brain fog? So what's causing the blockage of information? Well, there's no definitive answer. One idea is that your body's immune system response could cause inflammation in your brain. When inflammation occurs, this could cause a temporary blockage in processing information. Brain fog can also be caused by chronic stress, hormonal changes, or blood sugar imbalances. Gut inflammation, head trauma, thyroid issue, acute chronic stress, sleep issues, allergies, and even dehydration. So what are some of the signs and symptoms? Mental fatigue, difficulty concentration, irritability or mood swings, lack of motivation, dizziness or lightheadedness, memory problems again, and difficulty remembering words. So what are some common conditions associated with brain fog symptoms? Pregnancy. You experience a range of hormonal changes during each trimester. When these hormonal changes occur, your brain tries to restore balance by releasing and suppressing certain hormones level out of everything. You may experience brain fog because of this constant flux of hormones or because of other stressors that can occur even early in pregnancy. Now, brain fog is very common in this next one that I'm going to talk about, COVID-19. Brain fog has been getting its fame thanks to COVID-19 and all its related symptoms. In fact, brain fog is one of the top 3 symptoms often listed by long haulers. So people that have had long battle with COVID-19, who experience prolonged symptoms or delayed symptoms weeks and sometimes months after the initial infection. Depression and anxiety. One can often lead to other and vice versa. That's your body's fight or flight response. At times, your body goes to this fight or flight in how to deal with things. So brain fog associated with depression or anxiety often feels like constant fatigue or a general sense of malaise. Others, chemotherapy. Food sensitivities. Some food sensitivities can also lead to brain fog or its associated inflammatory response. For example, people with celiac disease, people will often complain of feeling cloudy or bogged down because of their gluten sensitivity. Blood sugar levels. If you have low blood sugar levels, hypoglycemia, you may feel dizzy, lightheaded, foggy, or nervous and unable to concentrate. This is especially true in people with diabetes if their body creates too much insulin. Sometimes you can even experience low blood sugar levels after having a meal. Autoimmune conditions are well known for people autoimmune conditions to have brain fogs. Several autoimmune conditions are also associated with brain fog, including lupus, chronic fatigue syndrome, multiple sclerosis, fibromyalgia, leaky gut, surgeons, you name it. A lot of those patients do have brain fog. A prolonged attack on the immune system tends to have an impact on an individual's brain. Other conditions associated: hypothyroidism, chronic pain conditions, sleep disorders, eating disorders, and nutritional deficiencies, sleep aids and pain medication side effects, excess stress or post-traumatic stress disorder, hormonal changes, which I've spoken about earlier, and gluten sensitivity, also, as well as autism spectrum disorders or ADHD. So how is it diagnosis? So tools for finding the cause of brain fog. Naturally, your doctor is going to do a health assessment, right? They're going to talk about your diet, your physical activity, and your current medications, any symptoms that you're having. So it's good for you or those around you to be able to be good historians so they can speak about it. So how can you get rid of brain fog or manage brain fog? There aren't any definitive medications or treatments that correct brain fog directly. To immediately address most chronic stressors, focusing on improving your sleep, getting good nutrition, and exercising 30 minutes every day, 5 days a week. I know nobody don't want to hear that. These small changes to your everyday life can build up over time and greatly impact your immune system response and reduce inflammation. Use memory aids to help with cognitive symptoms. Practice self-compassion and be gentle with yourself. And those around you need to be gentle also, and understand that you have no control when this happens. DASH intervention or neurodegenerative delayed diet or Mediterranean diet. Both eating patterns focus on adding more olive oil, fruits and vegetables, nuts and beans, fish, whole grains to help support your brain health, including memory health across the lifespan, your lifespan. Vitamins and brain fog. Getting rid of brain fog in some cases may mean treating any underlying nutritional deficiencies that may be causing symptoms. Common vitamins associated with brain fog and brain health includes vitamin D, your omega vitamins, magnesium, vitamin C, and vitamin B complex, and zinc. Research on vitamins therapies for brain fog is mixed, and there's a lack of rigorous clinical trial research in this area. But I've known people that actually have taken the vitamins and it has worked very well for them. Continue learning new skills throughout your lifetime. Stay social or increase social activity, such as volunteering, working with others, or joining groups or clubs. Reduce the use of substances that interfere with brain functioning, including alcohol. Make sleep habits a priority, aiming for 7 to 9 hours each night. Limit or avoid multitasking, focusing on one task at a time. Review your medication lists with your prescribing healthcare provider. Take breaks, reduce stress, and try to balance leisure and work. Get enough physical activity regularly and consistently. Eat a healthy diet rich in whole foods. Avoid excess screen time, especially before bed, and take regular breaks when using screens. Engage in mentally stimulating activities. When it comes to choosing an effective supplement for boosting brain power and improving cognitive function, some ingredients that are important are like Hyperzine A, vitamin B complex, DMAE, L-tyrosine, L-theanine, alpha-lipoic acid, guarana, ginkgo biloba, and brema. So here's some vitamins that I looked up that I have gotten some good feedback on and reviews: Brainol, Neurofuse, Brain Fog Relief, Prevagen, Neurovia, Bright Smart, Pure Memory Pro, and Natural Factors PS, just to name a few. In conclusion, brain fog is that fuzzy, forgetful feeling that can happen for various reasons. It has no age limit. It has no racial boundaries. Anyone can have this. Knowing the cause of your symptoms can help determine if you need specific treatment or lifestyle and medication adjustments to help with brain fog. However, there are many ways to manage brain fog, including getting adequate sleep, nutrition, and social time, managing stress, and addressing any underlying contributing factors like ADHD or depression or any autoimmune disease. The cloudy thinking you get with brain fog is not and very different from cognitive problems associated with dementia or Alzheimer's disease. The key difference is that disease like dementia and Alzheimer's disease affect more than memory. They change your ability to function in your daily life. I want to give special acknowledgement to Very Well Health, the Cleveland Clinic, and BrainCenter.net for the information that I provided to you today. I hope this was helpful. I'm sure a lot of people are going to sit back and try to assess themselves now. Please feel free to join me in the Zoom room should you have any questions for me, or you can leave your questions on my YouTube channel, and I'll be happy to answer them for you. Brother Rob also helps me to monitor that, so that's a good thing. Thank you so much for your time and attention. God bless and enjoy the rest of the service.